Hi, this is Dr. Nikhil. I'm the Chief Neonatologist at Aster RV Hospital, JP Nagar. Today I will be talking about newborn screening. Newborn screening checks for inherited common metabolic disorders. So there are a few disorders which are very common in India. Metabolic disorders happen when some of the enzymes are absent or some of the breakdown pathways are not working. For example, protein breakdown pathways or fat breakdown pathways or carbohydrate breakdown pathways. There are a few inherited metabolic disorders which are common in India. So to check for those, we do a newborn screening. So the first thing that we check for is for congenital hypothyroidism, wherein we check for the levels of thyroid stimulating hormone or TSH. Congenital hypothyroidism is a preventable cause of mental retardation and it can be treated with a simple tablet. That's why it is important to check for this. The second thing that we check for is what we call as a G6PD deficiency. This is a hemoglobin disorder and it is inherited. In this, there is excess breakdown of the RBCs which happens and which can cause jaundice at a later period. This can be prevented by not ingesting certain medications, because of which this again becomes important. The third disorder that we will talk about is cystic fibrosis. This is an inherited disorder of the lungs. This can be managed nowadays, which is why it is important to look for this. The fourth one is biotinidase deficiency. In this, the pathway is not able to process the specific vitamin called as biotin, which can cause multiple skin and neurological issues, which is why this is important to check for. The next one is phenylketonuria. This can cause multiple issues with regards to the brain damage, liver damage, etc., for which this is again important to check for. This is what we call as a basic panel of newborn screening. There is an extended panel as well, which we can check for all the other protein, amino acids, or fat metabolism, etc. The way to check for this is very simple. We take just 5 drops of your baby's blood, and this is done by a technique called as a tandem mass spectroscopy. The turnaround time for this test is around 4 to 5 days, and this can be done at any point of life, but we prefer to do it soon after birth, at least after 24 hours, for the reasons mentioned above. We at Aster RV endeavor to get your baby's health in check as much as possible. So feel free to contact us for further information.